New public health restrictions as new daily COVID-19 infections have now surpassed 3,000 for the first time since March. Now, at this point, with numbers expected to only go up, 3,161 were detected by 10 p.m. last night. The government ministers will consider plans now to further rein in large gatherings and return their focus to the re-entry of travelers from abroad and the enforcement of quarantine measures. Now, the health ministry is also planning to recommend that the ministers expand the so-called Green Pass so that it applies as well to children under 12, all of the school year just 1 month away. For more insight, we're joined by Dr. Orna Baron-Eppel, a professor at the School of Public Health at the University of Haifa. Always appreciate you on the program. Here, it seems surprising, or at least I believe it's surprising to many in Israel to see the numbers reaching levels I think we simply didn't expect to see, with so-called herd immunity on the rise and around 80% vaccinated. Who's being infected at this point?
Yes, first of all, it is surprising. I think we all thought that we were doing great and that was it. We were past the corona, but we're not. And I think this is going to be our future. You know, we're going to have to live with the new variants that come in. That's why I think it's so important that the government does take care of people who are coming into Israel. I think they really should be quarantined for the first few days after they come in, of course, with the testing. But that's a very important port of the new variants coming in. And this will go on for a long time when other countries still have a roaring disease epidemic in them. So variants will be forming in other countries and they will be coming into Israel. So that's really a first thing that the government does have to see. I think there's a big problem, though, with enforcing people to stay home when they come back from holiday or from abroad or, you know, whatever. The government will have to think of how we enforce and keep people from going out into the public and, you know, after coming back from abroad. But that's only one thing, you know, one problem that we have. I think the Green Pass can really help a lot. I think that can have a big effect when people know that they have to prove that they are vaccinated or that they're immune because they have the disease or whatever, but they can't just go into big gatherings or, you know, art places or cultural, you know, gatherings without knowing that everybody around them is vaccinated, because otherwise it's just a great place to disseminate the virus more and more in the public.
Do you expect what about places like that aren't a choice? I mean, yes, people can choose to go to a concert venue or some other wedding hall or something of those along those lines, but what about the daily commutes on the buses or the trains or the places that are simply crowded based on daily use? Do you anticipate more restrictions coming into those realms of public life?
Well, I'm not sure we have to take into account, you know, on one hand, going on with our lives, yeah, and on the other hand, how do we prevent the disease from, you know, just getting around? I think that, you know, public transport is a little problematic to really use the Green Pass. People do have to travel from place to place, and it'll be difficult to really enforce. So we have to really make decisions between what we have to do to go on with our lives and what we can control and we can prevent, you know, from really large gatherings, big weddings. I really don't see a need to go to, me personally, for example, I don't see a need to go to a large wedding with hundreds of people these days. No need for that, okay? So those are things that we can control without disrupting our life completely. Okay, public transport is a little more problematic because, again, we will be hurting the people who don't have private cars and do want to travel to work and back, and we can't prevent that somehow. But I really think we do have to put more pressure on on people to get their children over 12 to get vaccinated. I do believe that we have to do the vaccinations in schools. I know that there are people who don't agree with that, but I think from a public health point of view, we really do have to vaccinate in schools and get all the kids that can get vaccinated. That's very important. And we're not up there yet. I can't remember exactly the percent of teenagers that are vaccinated, but it's not 100%. It's not even near 80%. So we do have to get that group vaccinated. And of course, getting the other million people who are not vaccinated vaccinated is also very important. It's not easy. It's not easy because a lot of these people have their beliefs, and whatever you tell them, it won't help. So I think that's why the green passes are so important, because they can have an influence on people who are sitting on the verge of, do I get a vaccine or don't I get one? So the green pass can really help them, push them a little bit towards getting a vaccine.